Good morning. My name's Liz Bennett. I'm Chief Nurse at Public Health England and the National Chief Nurse for Public Health Nurses, Midwives and, of course, health visitors. I'm delighted to be talking to you today as part of #Health Visiting Week, a really important week for celebrating the contribution of health visiting to improvements in health for our children and families. I've been asked to cover some of the more overview, strategic stuff like the role of Public Health England, how Public Health England and health visitors can work together to achieve our shared agenda. So the first slide sets out the people that and organisations that need to be involved in protecting and improving the population's health. Public health is sometimes used as quite a specialist term, so we tend to use the term protecting and improving and population health to show that this is a joint endeavour. And this slide sets out the responsibilities of some of our national bodies and our national communities to support the public to protect and improve the health of all of us as citizens. So local government, clearly very important in place-based, the voluntary community sector playing a huge role, particularly around strength-based communities. Industry, big contributions both as employers and in the products that we consume. Global public health, we are part of a worldwide endeavour to secure health across the world. Our science is a very key part of what we do, a very big part of UK PLC at the leading edge of developing a whole range of programmes to improve health. And of course, national government sets the policy context and the legal framework in which all of these work. Public Health England, as part of that, has some very specific responsibilities, and these are shown on the next slide. These are set out in a remit letter. The remit letter is in fact like a mandate. So we, in Public Health England, receive each year a set of deliverables from the government via the Department of Health. The overarching remit of Public Health England is to protect from threats to health, to improve the public's health and well-being, to improve population health through healthcare and services, and to build capacity and capability. So you can see, even in the big overview things, an immediate link to the role of health visitors and what we often call the children's public health field force. The work that the remit that we have to deliver could not be achieved without people at the front line. And some of the ways in which we do that are shown below, and you'll see again very direct connection, evidence-based practice, place-based approaches, developing and engaging local communities, and I'll talk a bit more about that later on. A life course approach, which of course is what we do as health visitors. We look at the individual from birth, growing through childhood and into adulthood as part of the family and the community in which they live. We'll come back to the childhood part of the life course specifically when I talk about our best start priority, but just to give you a bit more information about PHE, the next slide shows the remit of the Chief Nurse Directorate. So you can see that we are responsible for maximising health and care professionals' contribution to prevention and improving and protecting health, and I'm going to talk about the programme through which we do that in just a minute, which is All Our Health. We actually lead for the organisation jointly with the Medical Director on quality and clinical governance. We provide professional advice and leadership both nationally and internationally, and lead a programme of international work around public health nursing and midwifery, particularly around maternal and child health. And we lead some big programmes of which many of you will be aware within PHE, the Best Start Priority Programme and the Maternity Transformation Programme Prevention Workstream. And on the other side of the slide, it lists out the responsibilities of the Chief Nurse. So it shows you what I do all day. So just to touch on All Our Health, the new programme around prevention and population health, the framework's shown on the next couple of slides. We know that the 5-year forward view talks about a real need to close the health and wellbeing gap. It actually talks about closing 3 gaps: the quality and care gap, the finance and productivity gap, and the health and wellbeing gap. And clearly we're very focused on delivering the closure of this gap, which impacts on the others. It talks about the need to contribute to a radical upgrade in prevention and public health, and it talks about a need for a social movement in health. And as public health nurses, midwives, health visitors, as public health practitioners, I think we have a real role in contributing to these developments. And All Our Health is a programme that seeks to support you in that work through providing a whole range of resources and providing a focus around which to group. And you'll be hearing a lot more about All Our Health as this year progresses and it's developed as a fully digital product. The second slide about All Our Health shows how the whole framework fits together. The headline being, this is a call to action and all healthcare professionals are a vital resource for health. How do we realise the potential of that resource? How can we take action by doing things, through being connected to things and on specific topics? And how do we use the relationship and reach that all healthcare practitioners have? I think health systems particularly have, because of the enduring length of time of those relationships, to really support people to develop well-being and resilience in their own health world and that of their families. And you'll see there's some specific products which apply to the practice of health visiting, including Best Start, Healthy 2-year-olds, for example. So that's a bit of an overview of PHE, what we do, how, and hopefully to show you some direct connections with your work. The next slide starts to talk about our priorities as they connect with child health. And PHE's initial priorities were published in a document called Evidence into Action. We know what works in many of these areas. We need to work with partners and practitioners to actually get this into action. And the ones which have particular relevance to children are shown here. So childhood obesity, reducing smoking and stopping children starting smoking, reducing harmful drinking, tackling antimicrobial resistance. Our young people are coming to know that it's going to be a different world for them, and as they kind of summed it up, there's not a pill for every ill. So big priorities that impact on children. A particular focus, and particularly where we've worked very closely with health visitors through the professional bodies and with health visitor practitioners and leaders who've come to work with us, is ensuring that every child has the best start in life. So what's the evidence around best start in life? I'm clearly preaching to the converted when I talk to health visitors. We know that there is a huge body of evidence that says what matters to you in pregnancy and in the first weeks, months, years of life impacts well into adulthood and on your life chances for your future. This infographic is part of the Health Matters series, and it tries to summarise that concisely. I'll be showing you another couple of infographics. These are produced for your use, and we hope you find them useful. The link to Health Matters is there. Do take a look and do come back to us with any comments. So it talks about the importance of secure relationships and the early attachment, emotional well-being, brain development, language acquisition, etc. All things that you're very, very excited on. So moving on now to the Best Start in Life, the actual programme. How have we constructed the programme and why? So we have 4 big ambitions: that women have a healthy pregnancy, that children are ready to learn at 2, ready for school at 5, and that we reduce the rates of childhood obesity. And you can see already the contribution that health has played to supporting the work to achieve these big ambitions. PHE leads the programme on behalf of the health system and leads it jointly with local authority to make sure that we have that integrated engagement. So the overarching elements of the programme are the work we're doing on a healthy pregnancy as part of the maternity transformation programme. This is the national programme to implement the findings of the National Maternity Review and the Secretary of State Safety and Maternity Services campaign. and we'll be very much focused on the contribution that prevention can make to improving outcomes. The second area that's really important to us is some of the ones that have been summarised in the high impact actions, and a very big focus on action on perinatal mental health. And the work that's already gone on through health visiting services gives us a really strong basis from which to grow. The second thing is around improving the evidence for early intervention. That might have been the third. The next thing is national support for local leadership, and it says there in capital letters place. What that signifies is increasing awareness that in order to impact change, it needs to be in the context that people live their lives. It basically means where they live them. Your chances still vary hugely across geographies and communities in this country, and we need to make sure that we're taking forward work that suits those people in those places and works with them to make a difference. We also have some responsibilities around parent and public information. Going back to the inequalities agenda, we've picked some areas for action where we know that there is big difference in outcomes, but also where they are markers for inequality. So the ones that are listed there: breastfeeding, children's teeth, speech, language and communication, development and accidental injury, all you are more likely to have poor impacts from all of those depending on your socio-economic group and where you live. So taking action on those is really important. And finally, it's very important that we don't lose vigilance on health protection. Immunisation rates are very, very important. And in two particular areas, we want to work with midwives and health visitors as a focus at the moment, and that's increasing the uptake of maternal flu and pertussis immunisation, because we had babies die of pertussis last year, and we can prevent that. So those are the headlines around the Best Start in Life programme. What does that actually mean we need to do locally? And the next slide sets out a summary of some of the things that need to happen. So PHE is working with partners and professionals in places for the best start for every child. And excuse me, this slide shows 4 areas through which we need to use the levers and to involve people. The first one is coordination and local leadership, and we know that health visitors are local leaders to Healthy Child programme, working very skilled ways to bring together the NHS and family services, and we need to continue to work with you through that. We know that there are some gaps, that not practitioners at the front line aren't always as involved as they could helpfully be, and we're going to do some work advised by the professions around that too. Commissioning is a really important process with increasing focus everywhere on integrated and whole systems commissioning, and we need to make sure that children and families' needs are represented nationally and locally in that work. Communication and community engagement I've touched on before. Health visitors' vital role in knowing their local communities and being able to broker some of those discussions, and then to bring that knowledge and experience into the commissioning process. And fourthly, it's summarised as care pathways. In this case, I mean the Healthy Child programme pathway, which we'll talk about in a minute. And as I've said, PHE sees health visiting services as the child and family public health field force, working with you and through you to communities and families to deliver some of these programmes. We've got a couple of other infographics for you to look at, which touch on some of those areas of inequality that I was talking about. The first one shows the healthy pregnancy work. The next one touches on our breastfeeding work and shows really how poorly we're doing and how we need to improve. And the next one picks up what I was talking about in terms of a healthy start and in terms of keeping the vigilance around health protection. And again, they're all from Health Matters. My colleagues will be covering all of these in more detail in subsequent presentations, and I hope that you find them useful. If we look specifically at the role of health visitors now, and where I think these things connect, the first one is health visitors as local leaders of a Healthy Child programme 0 to 5. And I've always been very, very committed to the fact that this is a population approach. Health visitors don't deliver this to individual families. They do that, of course, and that's very important work, but they do more than that. They are the leaders of this programme in a community, and certainly that's something that we discuss very often at the Best Start Board. Your leadership role is vital to making sure that this programme delivers what it can in terms of child health outcomes. The next slide summarises some of the work that we've done, advised by you, on evidence-based practice and high-impact interventions. This is an area where commissioners are very, very interested to see how they can use the skills of the health visiting workforce in delivering on some of these really important areas to address local needs, narrow some of those gaps, and to, in terms of PHE wide, help us to deliver on those big priorities I identified earlier. You're all familiar with the Health 4, 5, 6 model. You'll see the other side of this infographic shows you how that progresses through to 5 to 19 as well. So very important work on evidence-based practice. And again, colleagues will be picking up some of those topics later in the series of presentations. The next slide shows depicts how important it is that we work with you around building community capacity. It was a big part of the early development of the Health Visitor Call to Action. We know that there have been some fantastic projects locally. I think our challenge now is to how do we get this as place-based prevention and asset building at scale. And we have other groups developing that within PHE, and I guess it's my job to make sure that those links are made and to keep the really important role of health visitors fully engaged and at the forefront of developing approaches with our local communities that give us good places to have and bring up your children. So that's an overview of what PHE does, the relationship we have with health visitors, and some of the specific activities that we're undertaking in the 0 to 5 age range, life course. So how are we going to measure success? The next slide shows you the markers that are in the public health outcomes framework by which we monitor some of this. We, of course, have other data collections as well, including the one about the 5 mandated contacts and the coverage of those. We are developing further measures around the 2.5-year review, and the child and maternity data set is running now and will be robustly populated over the coming months. So it is really, really important that we keep these in sight. The Child and Maternity Network has just, previously known as TriMat, has just launched a Best Start portal which people can look at, which brings all this information together. How well are we doing? How are all our efforts to improve things for our children translating into local improvement? What can we do more? It's really, really important. People in a time of financial difficulty are very focused on outcomes and return on investment, and the better the data we have, the better we can link it to practice, the more use that can be in planning of future services. So very, very important that we do that. But I guess for me, all that said about metrics, there is a big picture about what success would mean, and that we tried to show this in the next slide. So for us, healthy pregnancy, vital work, ready to learn it too. Our 2-year-olds still have mixed experience, and how can we make sure that we can provide extra support for those families that need it, so that their child is ready for school at 5, as judged by some of the factors that we have here, is ready to access their education as fully as every other child, and that every child has the best start. And I guess finally to say that this is really, as shown in the last slide, about making sure that no child is left behind. And I think in the partnership that we have, PHE partners and professionals, we really can bring our skills, knowledge, relationships, and actually our passion for improving things for children and families together to make sure that no child is left behind. In terms of things that you may find helpful, the very last slide gives you a list of products that you may wish to look at to support your day-to-day practice, whether that's in frontline services, health to leadership or management. So thank you very much for listening. I'm sure you'll have very good information in the subsequent presentations that look at more detail of some of the things we've covered. Thank you very much.